Gaining freedom from health debt is really what this podcast and greatmed.org is all about. Putting power in your hands to improve your God-given ability to be healthy. Many people with preventable disease want to make lifestyle changes. They want to improve or reverse disease, but they don't know how. Walk, Don't Run to the Doctor is the resource hub that is a cure for a common confusion about healthy living. Welcome back to Walk, Don't Run to the Doctor. I'm Miles Hassell. I'm a practicing physician in Portland, Oregon. And we're going to be talking today about blood pressure drugs. They can help you or they can kill you. And as you're listening to this, remember, I'm somebody who prescribes blood pressure drugs pretty much on a daily basis. But that doesn't mean I like to. It also doesn't mean I'm trying to kill my patients. I'm trying to help my patients. But for most patients, under most conditions, there's something better they can do than take blood pressure drugs. So let's back up a little bit and think about blood pressure treatment. Why do we worry about high blood pressure? We worry about high blood pressure because high blood pressure causes a plethora of very, very serious chronic diseases with severe and life-changing consequences, things that make life kind of miserable. And just some of the high points are stroke and congestive heart failure and vision loss and kidney failure. These are things you don't want to have. And so when you're looking at things you don't want to have, what are you going to do about it? And so for most patients, not everybody, but for most patients, the best treatment for your high blood pressure and preventing those chronic illnesses is lifestyle change. And so we're going to be talking about why lifestyle change is superior to a pharmaceutical treatment of high blood pressure, while still recognizing that high blood pressure pharmaceutical management still has a place, an important place. But lifestyle medicine has a more important place, and we aren't going to be talking about in detail about the steps you can take, but we do talk about this on page 101 of our book, Good Food, Great Medicine, in the 4th edition, and in the Walk, Don't Run to the Doctor episode number 14. If you want sort of the more of the gritty details. But we're going to be talking more about the blood pressure drugs themselves today. So some patients with high blood pressure need medications because they've got an inborn error of metabolism in some way, most commonly in their kidneys or their adrenal glands, a blood vessel issue. There's a number of diseases that we really need to use medications for. But the vast majority of patients get better results with lifestyle change. And for them, blood pressure medications may be the worst way to treat their high blood pressure. Maybe better than no way at all, but maybe the worst of their choices. So you might be saying, well, how can my blood pressure medications that are being prescribed by a caring physician be harmful to me? Well, there's two main ways. The first is the direct side effects or drug toxicity. And remembering an aphorism that should be ingrained in all of our minds, that all drugs are poisons with potentially useful side effects, no matter who has approved them, no matter who is prescribing them. And this is not a new concept. When drugs were first starting to be used more widely back in the 16th century, a Swiss doctor called Paracelsus referred to this concept. He put it much more elegantly and in a little more complete fashion, but it's not a bad reminder that all drugs are poisons with potentially useful side effects. So if you need a poison, it better have a pretty good side effect for you. The second reason why high blood pressure medications might be doing you harm is because they can be a dangerous deflection from something better. So for example, if you're somebody who eats badly, doesn't get much exercise, is significantly overweight, and you have high blood pressure, and somebody gives you a blood pressure drug or 2 or 3 that beautifully control your high blood pressure, and we see this every day, then you may be dissuaded from doing the hard work of lifestyle change, which would also give you beautifully controlled high blood pressure in most cases, but without any side effects, and with dramatically better long-term benefits to your health. So that dangerous deflection is worth thinking about. So let's go in and talk briefly on what are the benefits of high blood pressure medications. So, why do doctors who really don't like them much, like me, prescribe them on a daily basis? Well, because in some patients, they can reduce the risk of damage from the high blood pressure, such as protecting the kidneys or the heart, or especially preventing stroke. But even in my best controlled patients, the risk of complications in somebody on high blood pressure medications is still abnormally high, and side effects remain a concern. In other words, the degree to which I help their high blood pressure using medications is less than they would achieve if they did the same thing without medications. Just to repeat myself, sort of, the lifestyle choices that reduce the need for blood pressure medicines have a greater beneficial impact on the brain and the heart and the kidneys and eyes than blood pressure medicines do. Plus, they've got this broad range of benefits for the whole body, including things like cancer risk and so on. And as we go through this, remembering that it's not all or none. So some patients with superb lifestyle management of their high blood pressure still might need to be on one medication instead of 4, or a much lower dose of medications they would otherwise need. So remember that this is not a diatribe against taking blood pressure medicines at all. It's an encouragement to find alternatives with lifestyle. So let's touch on, we talked a little bit about the benefits of high blood pressure drugs, which are very real. Now what about, how is lifestyle medicine superior? Let's just talk about that for a second in a little bit more detail. First of all, lifestyle medicine is superior to the use of blood pressure drugs because it avoids drug side effects if it works. It's cheaper. You don't have to keep going to doctors or have lab monitoring or things like that. But once again, I assure you that the data shows that people who don't need blood pressure medications have much lower risk of stroke and heart disease and diabetes and kidney failure than patients who require high blood pressure medications to get to the same blood pressure. And when patients are treated with high blood pressure medications, for example, take stroke, a patient who has beautifully controlled high blood pressure still is at 2 or 3 times higher risk of stroke than somebody who does not need blood pressure medications. And once again, I emphasize that there are some patients that still need high blood pressure medications no matter how good a job I do with their lifestyle, or how good a job they do with their lifestyle, of course. In our book, starting at page 101, we talk about a lot of the different things that you can do for high blood pressure. And we talk about the eating a Mediterranean-style diet, more fruits and vegetables, especially with every meal, weight loss, exercise, extra virgin olive oil, all these different things. In addition, we talk about the things that might be causing your high blood pressure that you haven't really thought about. Maybe it's you're drinking too much alcohol. Maybe you need to be using less ibuprofen. Maybe there are other medications that you could get rid of that are actually causing your high blood pressure, and this is something you can talk to your doctor about. Maybe you can get a dog. Did you know that people who walk their dog have lower blood pressure? Our book is Good Food, Great Medicine. It's in its 4th edition, and it's written by me and my sister Mia. It's been a help, I think, to a lot of people in terms of learning how to use lifestyle to make them less dependent on medicine. And so just reading our opening paragraph on high blood pressure, we comment that high blood pressure indicates multiple areas of metabolic dysfunction and can potentially damage almost every major organ system. Although many drugs are available to treat hypertension, there are lifestyle steps to help control your blood pressure with less medication while improving overall health. Don't lose sight of the most important steps: daily exercise, eating vegetables or whole fruit with every meal and snack, reducing sugars and refined grains, and losing excess inches at the waist. And then we go on for another page and a half talking about this. Don't overlook the fact that you might need a whole lot more resources than this podcast to help you understand what to do about your high blood pressure. You may have noticed the reference I just made is that you may have high blood pressure for reasons entirely outside of your body. And a common example for us in our practice is people who are taking ibuprofen. But there's many other drugs. I'm not just anti-ibuprofen, but it's worth talking to your doctor about, hey, is there something else that's going on? Do I need to cut back on my alcohol intake? And so on. Did you know that the average American spends 6 months of their life in pharmacy lines? And people who take good care of themselves and eat more celery, maybe, I don't think they do. So when you're thinking about this whole issue of high blood pressure and high blood pressure medications, there's a few questions you might want to talk to your doctor about. Why was this drug prescribed? One size does not fit all in lifestyle medicine or blood pressure medicine or anything else. And so find out from your doctor to make sure that you know why you were prescribed the high blood pressure medications. Was it primarily because you have what we call essential hypertension, or is there something special about your heart or your brain or your kidneys or something like that makes it particularly relevant to you? And from that, you can then ask the question, what does this drug promise to do? And what are the chances that it will do it? These are useful things to talk to your doctor about and get a sense of of just how important is this drug for you, because it may not be very important at all. Ask yourself, this is primarily something you'd ask yourself, is this something you'll have to take forever? And that usually is in the hands of the patient to say, how good a job am I going to do in taking care of myself? And then you might want to invoke a little motivation. And one of the great examples of motivation is to look at the package insert that might come with your drug. And so package inserts, they kind of look like this. There are lots and lots of paper. For the people on visual, they can see it's a tightly folded bunch of thin paper with lots and lots and lots of words and facts. And when you look at those words and facts, it might be kind of scary. So one of my favorite high blood pressure medications, this is one I commonly prescribe. I commonly prescribe this drug, and yet when you look at the side effects list, it includes things like chest pain and peripheral edema and vertigo and abdominal pain and dyspepsia, that means tummy upset, and other forms of abdominal problems. Rapid heartbeat, it can change your cholesterol levels in abnormal ways. It can cause uric acid and gout. You might get painful joints or muscles from it. It can alter your liver function in adverse ways. Blah, blah, blah. And another really common one, a thiazide diuretic. These are commonly used as well, and they're good drugs for people who really need them. Similar huge list of bad things, pancreatitis and jaundice and rashes and kidney failure, fainting. And so if we're going to sort of comment to you on what we see on a daily basis from blood pressure medicines, and I don't think I'm exaggerating much when I say daily basis, but if you ask questions of people who are on high blood pressure medications, you often hear about fatigue. Super common. Depressed mood, probably as a result of the fatigue. And you can test this by getting them off the blood pressure medicine and say, hey, do you feel better? And they say, yeah, I do. Rashes are really common. Some of the blood pressure drugs cause rashes that are particularly going to show up if you're in sunlight. Fainting and associated injuries. And this is something that really troubles us in our older patients, because many, many older patients are being treated fairly aggressively for their high blood pressure. They often have some lightheadedness or dizziness. They fall and they break their hip or something else. Maybe they break their head. These are not good outcomes, and they are often directly attributable to the high blood pressure medications, but in terms of our health statistics, they almost never show up. So this is, I would argue, is a really common side effect of blood pressure medications, falls in the elderly, that is usually not recorded as such in our national health statistics. Erectile dysfunction in males, kidney failure, edema or dehydration, so sort of two opposite things depending on which medication we're talking about. Gout, surprisingly common. High blood sugar and diabetes. Many of our high blood pressure medications accelerate the development of diabetes. All kinds of electrolyte abnormalities, sodium and potassium and magnesium and calcium abnormalities that can cause all kinds of problems, like muscle cramps, heart electrical dysfunction, so that people get palpitations, things like that. And then, of course, there's the issue of polypharmacy. So you're on a high blood pressure drug, and you get some side effect, and now you get a drug for the side effect. So maybe it's giving you gout. Your doctor overlooks the fact that the gout is due to the high blood pressure medicine, and now you're on allopurinol and colchicine because you've got gout. And so now you got pain, 3 drugs, and you're still not feeling great. So I think there's, for many of us, looking over the list of side effects of high blood pressure medicines really is a sobering step to take. So think about how all these side effects can cause problems in your relationships, whether it's intimacy or just fatigue, you ache. These are all very real issues that really mess up life on multiple levels. And I keep coming back to this thought. Is the blood pressure medication an optimal approach for your high blood pressure? And I'm arguing that for most people it is not. And so then you have to ask the person in the mirror, what do I want? Do I want a substandard way to approach my high blood pressure? Or should I be pursuing a more vigorous lifestyle medicine approach and see if I can get off these medications? Do I want optimal healthcare or mediocre healthcare? It's often in your hands. And there's 4 main steps. So if you look at our book, there's whole 3 pages on how to lower your blood pressure with lifestyle. And so, but there's 4 big elements that I'd like you to have as a takeaway. First of all, optimal control of your waistline. If Even a little bit of excess weight on you can contribute to high blood pressure. And yet, for people who are really heavy, often only 10 or 20 pounds of weight loss will take care of their high blood pressure. So where you are in that spectrum, well, I don't know. But optimal control of your waistline is the first step. Increasing physical activity and muscle mass. So we actually often prescribe a short burst of exercise, even as little as 1 minute, 3 times a day. Keep your metabolic rate up. Keep moving. Maybe add some resistance exercise like weights to improve your muscle mass. And you may be amazed at how much not just your blood pressure improves, but how much better you feel. Eating whole foods, including fruits and vegetables with every meal and snack, and high nitrate vegetables, of which the best example probably is celery, is particularly effective at lowering blood pressure. So we often recommend people have 2 or 3 stalks of celery a day, which with a little bit of peanut butter on it, that makes a meal. So it becomes part of your weight loss program too. And finally, minimizing anything that can be causing high blood pressure. So we talked about in the drug world, it's things like ibuprofen and other non-steroidal anti-inflammatory drugs and other drugs. But also sugars, sweets, breads and other foods made from flour, chips, tortillas, pastries, crackers. And then pretty much all foods made outside the home are guilty until proven innocent. So basically, it's really hard to employ lifestyle medicine effectively without being a cook. You probably need to say, you know what, I better get a chopping board and a chef's knife and spend more time in the kitchen. Because industrially processed foods really do seem to contribute to almost every aspect of ill health. You might be concerned. You might be saying to yourself, what is my doctor going to think if I try to get off the blood pressure medications? I argue that 99%, actually probably 11 out of 10 doctors who see their patients taking better care of themselves are delighted. And they're happy to work with you to see if you can get off your blood pressure medications. Cut out 1, cut out half of a dose, that kind of stuff. Gradually taper off them and see how you go as you employ lifestyle change. And see if over a couple of months, if you can get off your blood pressure medications entirely with vigorous work. And I think your doctor will be delighted. And your doctor can also advise you if it's not working. If you say, good try, but you've got an adrenal problem that doesn't allow you to completely get off the blood pressure medicine, but keep doing what you're doing because it's going to make you healthier anyway. And don't be easier on yourself. Lifestyle changes is hard. The payoff is enormously beneficial to you, both now and in 10 years. And small changes can make a big difference. I'm thinking right now of a patient of ours who was extremely healthy, vigorously active, very fit, ate really well, and still had really high blood pressure. So she really didn't like the side effects of the blood pressure drugs she was on. So in talking it over, she was about 5'4" and 135 pounds. And she looked great. She did not appear overweight at all. But she said, I could probably get down to 120, 125 and see how that works for me. So she cut out some of her foods, maintained her fitness, got down to in the low 120s, and bingo, she did not have high blood pressure anymore. And for the last 5 years, she's not had high blood pressure. So anybody looking at her would not have said, wow, you need to lose weight. But she herself knew she could drop a few pounds, and she was willing to do the work to see if she could get normal blood pressure and better health outcomes with less medications. So our podcast 14 goes into some detail on how to avoid using high blood pressure medications or using less. And our book, Good Food, Great Medicine, currently in its 4th edition, is also available to help guide you as well. And your doctor is probably willing to be some help. So thank you for listening. Remember, whenever you're in Portland, you can always join us at one of our town halls. Our next one is on September 25th of 2025 at Providence St. Vincent Hospital in the Souther Auditorium. And this one's going to be on cancer survivorship and prevention. And you can register at greatmed.org. So thank you.